This is a case of 50-year-old middle-aged female who presented to us with a history of dysphagia to both solids and liquids for 2 months duration. We are using upper GI endoscopy with a pediatric upper GI scope. Here we are passing the esophageal narrowing. This is the esophageal stricture, you can see, and this is the hiatal hernia. So with this pediatric upper GI scope, we are inflating the stomach, the pylorus. It's taking some time. So we want to see the stomach in the retroflexed position for a better view of the hiatal hernia, which usually accompanies these esophageal strictures. This is the retroflexed view. You can see a large hiatal hernia, Hill's grade 4 hernia over here in the stomach. Plan is to perform a CRE dilation of the stricture. This is the hiatal hernia again, seeing on the forward position. Our plan is to dilate this stricture. So this is vesicular guide wire, which we are positioning past the stricture into the stomach. We are using CRE balloon by Boston's. The CRE radial expansion balloon, which we have positioned just past the stricture, and we are inflating the balloon in a gradual fashion to 8 millimeter, then 9 millimeter and 10 millimeter diameters for a duration of 1 minute. This is controlled release expansion balloon for the dilatation of peptic stricture. Now we are deflating the balloon, as you can see over here, removing the vesicular guide wire, and we'll have a look at the stricture. The peptic stricture has opened up substantially. There is minimal ooze, which is expected in most of these cases. So procedure is complete.